Good afternoon, this is Dr. Robert Cohen. We're here today to do a PRP scalp. As you know, a lot of the alopecia in the scalp is due to decreased blood vessel supply to the follicles. Once the blood vessels get contracted or shrink due to multiple different factors, one of the main one is dihydrotestosterone, these blood vessels will constrict, blood vessels will actually atrophy away, the follicle will not be fed by the blood vessel, so then the follicle will then shrink and close and the hair will fall out. What we do is the PRP is activated. It has a number of different growth factors, and one of those growth factors is blood vessel growth factor, an angiogenesis factor. We inject that around the scalp every 2 centimeters. That will stimulate the blood vessels to grow, which will then vascularize the follicle, and then the hair will grow back. Sometimes people will get what I call shock loss. After about a week or two, the follicle will open up and any of that hair that has still been in there but that's not really growing because of the lack of blood supply will start to grow and it'll push that hair out. That's not to be worried because then the scalp will grow back, the follicles will grow back, and then that hair will grow back as well. It's a 2 to 3 treatment procedure. I like to use Viviscal with my patients. So on this young lady, you can see she's got pretty sparse in the crown area up top. And then as you can see going down, these areas I call the hallway. It's very sparse, not as bad as the crown. On both sides she's got it. So what we're going to be doing is we're going to be doing the hallways. We're going to be doing the crown this first treatment, and then the other hallway. And then we're going to do a little bit up front. Okay? See, we injected in the scalp, in the crown area, the hallways, what I call the hallways. Those are the 2 pathways. A lot of times in women, they'll get sparseness and lack of hair in this area right here. And then we just did a little in front. This young lady was more concerned with the crown and the hallways, so we did those areas. And we did a little anterior, a little front, but not a lot. We can always do this next time. She should start to see some little growth within 3 weeks, 4 weeks. Some of my patients will see it. We're going to put her on some Viviscal, which is quite good. It's got some chemicals in there that have been shown in my patients and also in the literature to stimulate more of the hair follicle growth and the hair growth. We'll see her back in about a month and we'll take a look. All right, this is Dr. Robert Cohen. Be safe, wear a mask, have a wonderful day.